oftentimes it's something it's an unspoken word of someone having memory problems. And oftentimes it's not addressed. And so that within itself, not being addressed carries a big weight on families and those that care for those families who are living with Alzheimer's and dementia.
Welcome to BrainStorm by Us Against Alzheimer's, a patient-centered nonprofit organization. Your host, Meryl Comer, is a co-founder, 24-year caregiver, an Emmy Award-winning journalist, and the author of the New York Times bestseller, Slow Dancing with a Stranger.
This is BrainStorm, and I'm Meryl Comer. In honor of Black History Month, our guest today is Dr. Charlene Whitaker-Brown, Clinical Associate Professor, School of Nursing at the University of North Carolina at Charlotte. But first, for background about the program that makes her appearance special, is Daphne Delgado, Vice President for Health Equity at Us Against Alzheimer's. Welcome, Daphne. Thank you for joining us. Why should we be talking about Alzheimer's disease during Black History Month?
Thanks, Meryl. And I'm so excited to have Dr. Whitaker-Brown with us today. I think talking about Alzheimer's disease during February is critical because it represents one of the most significant and often silent health crises facing Black families today. I think why the conversation is so important is because, firstly, there's a huge disparity. Black Americans are 2 times as likely than white Americans to develop Alzheimer's or other dementias. Alzheimer's is already the 6th leading cause of death for all older Americans, but specifically for older Black Americans, it's the 4th leading cause of death. And despite being at higher risk, Black Americans are 35% less likely to receive a timely diagnosis. They're often being diagnosed in later stages when treatment options are far more limited. So for that reason, Us Against Alzheimer's cares about eradicating Alzheimer's for everyone and ensuring that everyone has access to evidence-based resources, world-class treatment, personalized support. And to ensure that everyone gets what they need, we have to ensure that resources are specially tailored and relevant to each community's unique needs and priorities.
On that point, Daphne, how has Us Against Alzheimer's worked to ensure that different communities are reached with relevant resources?
Yeah, Us Against Alzheimer's, from its inception, was created to serve all communities struggling with Alzheimer's. It's in our mission statement, and it's been part of our work since its inception 14 years ago. We've always have worked to build creative and tailored strategies for engagement and information sharing. So I think just a few examples that I would love to highlight of work that we've done to educate people about disparities in Alzheimer's disease includes things like co-creating an award-winning stage play called Forget Me Not that showed the immense impact of Alzheimer's on African-American family. That play aimed to raise awareness and reduce stigma. That play traveled to 27 cities and reached over 30,000 people. We've also created the National Alzheimer's Disease Index, which uses Medicare fee-for-service data to look at national and geographic trends. From there, we were able to identify the top 50 counties with the highest prevalence of Alzheimer's among Black and Latino Americans across the U.S. And that helped Us Against Alzheimer's coordinate awareness efforts and local efforts by community-based organizations. And then lastly, the one that we're going to spend the most time focused on today is we created the Brain Health Equity Nurse Fellowship in 2022. And to date, 45 Black and Latino nurses have completed the program, and 2,300 people have been reached with evidence-based Alzheimer's prevention information.
So where were the gaps that really encouraged you to take that step and be creative to create this Brain Health Equity Fellowship?
Yeah, what led to the creation of the fellowship is indeed we identified a few key gaps. So firstly, nurses are the largest group of healthcare providers in the U.S., and they often serve as the first and only healthcare professionals that many individuals will encounter. But despite this, we saw that nurses receive very little to no dementia-specific education on Alzheimer's disease, and they receive minimal training on strategies to promote brain health in the communities they serve. So we launched the fellowship to advance the role of nurses as frontline leaders in brain health by equipping Black and Latino nurses with practical knowledge, leadership skills, and evidence-based communication strategies to support their community engagement and patient education on specifically Alzheimer's disease risk reduction. We're very, very proud of the work that these fellows have done in the fellowship and the difference that they continue to make well after they've completed it. And I think Dr. Charlene Whitaker-Brown is a wonderful example of the program's success. Charlene was a participant in our 2022 inaugural class, and she has continued to extend the learnings and connections well beyond the scope and timeline of the program. So that's why we're so proud to have Charlene in the USA2 family.
Thank you, Daphne. So now let's welcome Dr. Charlene Whitaker-Brown, Clinical Associate Professor, the School of Nursing at the University of North Carolina at Charlotte. Charlene, welcome. Thank you for joining us. What inspired you to become a nurse focused on Alzheimer's care?
You know what? Thank you for asking that question. In 2025, I celebrated 20 years being a nurse. So one of the things I'm super excited about is just my journey over time. So my journey has encompassed working as a medical surgical nurse, a nurse in the critical care unit before becoming a family nurse practitioner. Once I became a family nurse practitioner, I worked and treated patients as a nurse practitioner in heart failure. So I saw heart failure patients. And then I decided to transition to become a psychiatric mental health nurse practitioner. As a result of becoming a psychiatric mental health nurse practitioner, my key, I would say, the key people that I really work with are patients who are caregivers for Alzheimer's and dementia patients. So my heart goes out to these folks because not only am I their provider, but I also live the walk, I live the talk as a caregiver myself.
If you scratch the surface of our lives, many of us have walked that walk with you. Well, unfortunately, what else shaped your journey, and what do you see as the biggest barriers to equitable Alzheimer's care?
You know what? That's another great question. What I normally see some big barriers to care are probably being diagnosed late and not early. And then there's also a big stigma still around living with Alzheimer's and dementia. So those are a couple key barriers that I think are really critical. And then also access to healthcare. Sometimes there's a little bit of a delay with getting into a provider to be seen, or the wait list could be 6 months or 9 months out.
You know, that issue is across the board for all populations, getting to see the right neurologist. Tell me how you go about addressing the issue of disparities.
Yes. So I think it all boils down to education. If you're able to give those who need the information, that's a really critical and it's really integral into helping people overcome barriers. So knowledge is power, really. It really is power. And that's one of the ways that I address barriers.
So I'm a longtime caregiver. Tell me how you interface with someone like me. What do you say to us along the journey?
You know, I was actually talking to someone today who's a longtime caregiver, and it's one of the things to do is, you know, making sure that you let them know that they're not alone. A lot of people feel like they don't have anyone to talk to, or they don't have anyone that can help support them, but just let them know that there are resources out there and there is help.
You brought up an issue of the stigma. Mm-hmm. How does that affect communities of color around this disease?
Yes, that's really good, because oftentimes it's something it's an unspoken word of someone having memory problems. and oftentimes it's not addressed. And so that within itself, not being addressed carries a big weight on families and those that care for those families who are living with Alzheimer's and dementia.
Daphne, I'd like to bring you back into the conversation. Describe what culturally tailored outreach looks like and why it is so important for both the African American and Latino communities.
Like Charlene said, education is key, but how communities receive information, how they interact with that information may differ from community to community, state to state, on a whole host of different factors. And so it's about taking what the evidence says and making sure it is heard. So it's making sure that if a community gets most of their information from their local church leader, that you are connected with those churches. If a community gets their information through radio, that you're on the radio, that you're meeting people where they are with people who understand the local community needs, the local community barriers, and the local community facilitators. So many of these communities have wonderful assets, whether it's community centers or tight-knit families that can help each other out. And unless you're on the ground, you may not know of these things. And that's why it's so important to have people like Charlene in communities, people who are from the community, able to speak that language and communicate what the evidence and the science says.
And trusted as well. As Daphne mentioned, the Brain Health Equity Nurse Fellowship Program was created in 2022. Now, Charlene, you're a very busy lady. You're working, you're caring for a loved one in the family with the disease. How do you decide to apply for the Nurse Health Equity Fellowship?
Yes, so in 2022, that's when I started to actually become a full-time caregiver. And so at that moment, I didn't have the answers, and I thought I should have the answers being a nurse. You would think, well, I've been in nursing school, I'm a nurse. Why don't I know this information? So I started looking for answers and seeking out more information, and that's what led me to apply to the Nurse Fellowship, which was by far one of the greatest things I've done ever. That was one of the best decisions I've made in my life, believe it or not.
Well, that's great. Are there some lessons or insights from the fellowship that changed the way you work that you're excited to pass on to other nurses?
Well, I think Daphne said it best when she mentioned about meeting people where they are. That's one of the things that we took from the fellowship was meeting people where they were, meeting people where they are. Is it at a church function? Is it in a barbershop? Is it on the radio? But figuring out how to get the information to those who need it and in what type of process or what way to get them the information. So I think that was like one of the key things that I learned in the fellowship, which was so important, so critical.
There's always an issue of trust. What strategies help build that connection?
One of the things is nurses are known as one of the most trusted professions. And this is actually something I teach to my students. I had a health assessment class yesterday, and I told them, you're learning how to deliver important information, and you have to gain the trust of your patients quickly. So one of those things is you have to provide mutual respect, eye contact, talk to them, allow them to respond to you, and then just make sure you provide a safe place for them to talk and elaborate and ask questions. And I think those are some critical steps and tools that you can take to build trust and also establish that mutual respect.
Daphne, is there something you'd like to add to that?
I think one of the things that nurses are so particularly good at, and something that's really key in many Black and Latino cultures, is this aspect of storytelling. Nurses are such wonderful storytellers. They're able to advocate on behalf of their patients. They're able to advocate on behalf of the medical team, translate complicated language in a way that many patients and communities understand, translate the needs and the priorities of their patients and communities to a medical team. And those are all values that I think are really important, those soft skills that maybe aren't taught in many normal academic settings that we try to bring out through the fellowship process.
I don't think there's any family who's had a loved one with Alzheimer's in a hospital who has not appreciated the nurse who understood or was comforting in very challenging times. Charlene, the thing that impressed me about the fellowship was that it also is a connector for you to other nurses, other professionals in the field. How did you get involved? And tell us about the caregiver college that you helped support.
Yes, absolutely. So a year after the fellowship, I received an email to assist with the caregiver college. So researcher Dr. Goldberg of Wake Forest University Hospital reached out to me asking for my assistance and help. I live in a metro community, of course. As mentioned, I work at University of North Carolina at Charlotte. And living in Charlotte, they needed assistance to put on a caregiver college in my area. And luckily, I was identified as someone who was an expert in the field to help connect them. And being a part of the fellowship allowed me to be identified as someone that is recognizable, that can help collaborate and bring others together, bring people to the table. And this was an amazing experience. It helped me network with our local health department. It helped me network with our local areas, local entities, to bring all these folks together to offer more additional information to caregiving families on the basis of what Alzheimer's disease is, how to find out local resources, and then additional things about teaching and understanding different aspects of caregiving that they might not have thought about or know about. So all of those things kind of work together. So it was a really amazing experience. And like I mentioned, applying for the fellowship was by far one of the best decisions that I made. And I was so excited that as a result of being part of the fellowship, I was able to additionally offer more help to just a greater group of people. Initially with the fellowship, I just had to talk to nurses and some caregivers as well. But with the caregiver college, I was able to reach more people on a broader scale. And what I often say to them is, you're not alone and help is there. And I offer resources that I know about locally and of course nationally to help assist them to at least reach out and get a support group.
And we do know that 2/3 of the caregivers are women.
Mm-hmm.
As a statistic, what advice would you give to other nurses who want to focus on health equity and be part of the fellowship in the future?
Yes. What I usually say is go ahead and apply. Go ahead and apply for the fellowship and also seek other opportunities locally to be a part of different agencies, be a part of different clubs, be a part of different organizations. And not only that, it's important to get involved in the political process. So go to different functions on a political scale as well and be an advocate. So making sure you're a part of decisions and talks and making sure, you follow up and, talk to your local, I live in a county, so talk to like county commissioners. I guess if you're in a different state, talk to your parish or local people who are decision makers and make sure you lobby for great health care.
Charlene, in your role as a nurse, do you find yourself promoting brain health? And what do you say in underserved communities where there tend to be food deserts or it's not so easy to be brain healthy?
That's a great question because since the fellowship, I have done more advocacy work regarding brain health and awareness. I've been able to be a guest speaker at various churches, I've also promoted brain health at different workshops. I've done different types of expos and talked about the importance of brain health. I've had an opportunity to work with other nurses who are like nutritionists, and they're able to talk about some nutrition factors and important things to eat to be brain healthy. And then I've had an opportunity to talk to others and collaborate with those who are in physical activity and fitness. And we all work together to talk about how we can collaborate nutrition and physical fitness, and all of these things are so important and key when we're talking about brain health. And I think all of this stemmed from being a fellow with Us Against Alzheimer's, and that has enhanced my advocacy efforts towards brain health.
Let me follow up with a question, because you are on the front line in the nursing. You're building on a legacy of Black leaders and trailblazers, and this is Black History Month. Do you feel your work is additive to that trailblazing that's gone ahead?
You know, I often think about when I first started as a nurse and fast forward to now, and it's amazing how dynamic my career path has taken me, and as far as trailblazing, I think of those who were former nurses or people who, of course, like you mentioned, came ahead of me. But first and foremost, those folks who came ahead of me, I think, are like my grandparents, who established such a great foundation, and my mom, who instilled in me to always do your best and it continued to move forward. And as far as those medical leaders and nurse leaders, I think about like Harriet Tubman, who also, in addition to all the great efforts that she did, but she also acted as a nurse in the Civil War and cared for soldiers. Then I also think about Mary Mahoney, who was like the first licensed nurse. And then coming, of course, full circle, fast forward to modern day, I think of trailblazers such as former NLM president, of course, was it Beverly Malone, and also I think of Dr. Ernest Grant as the first male ANA nurse. So all of those things are so integral, and I feel like I'm standing on those shoulders of those great people who've done such great things ahead of me. And I just hope that I can just do half of what they've done in the future.
I'm sure you will. You're a great role model, and from one, you're going to influence many. That's the goal. Daphne, looking ahead, what's your hope for the future of nursing and Alzheimer's health equity?
I'm really optimistic about the fellowship and the role of nurses in Alzheimer's disease diagnosis and care as treatments and diagnostics get more sophisticated. I think there's a bigger role for primary care providers and for nurses overall. For the fellowship in specific, I think this program can grow a huge amount. I would love to see a nurse in every county in the US who knows and is, the point person for Alzheimer's and dementia care. It's certainly a big enough problem nationally. I would love to see nurses in community health centers apply for this program. I think one of the huge strengths of the program is that each cohort is incredibly diverse in terms of experience, geography, people involved. So you have nurses from every walk of life, and usually in every cohort, we have everyone from current nursing students to people who have retired, and this is kind of their second life, being more involved in the community once they've retired and they're doing this part-time now. And we have everyone in between, people like Charlene, who are at the height of their career. So I'm really, really excited about this. We will be announcing the 2026 class of the fellows in mid-February. And we continue to have the program going and growing for many more years to come.
Thank you so much. Our guests have been Dr. Charlene Whitaker-Brown, Clinical Associate Professor, School of Nursing at the University of North Carolina at Charlotte, and Daphne Delgado, Vice President for Brain Health Equity at Us Against Alzheimer's. That's it for this edition. I'm Meryl Comer. Thank you for brainstorming with us.
Subscribe to BrainStorm through your favorite podcast platform and join us for new episodes on the first and third Tuesday of every month.